Fine. You woke up this morning, had your breakfast, went about your day, and nothing felt wrong. No pain, no alarm, no obvious sign that anything inside your body was off. And that is exactly the problem. Because diabetes does not announce itself. It does not send you a warning. It does not wait for you to feel sick before it starts doing damage. It begins silently, invisibly, sometimes years or even a decade before any doctor ever catches it. And by the time most people find out they have it, the disease has already been quietly reshaping their biology for a very long time. This is what makes type 2 diabetes one of the most dangerous chronic conditions in America today. Not because it is instantly deadly, not because it causes immediate dramatic symptoms, but because it hides. It operates in the background while you live your normal life, eating your normal meals, feeling your normal self, completely unaware that your blood sugar has been creeping higher and higher, that your insulin system has been slowly breaking down, that your organs have been absorbing damage month after month and year after year without a single obvious symptom to alert you. Right now in the United States, more than 37 million people have diabetes. But here is a number that should stop you cold. Another 96 million American adults have prediabetes, which is a stage right before full diabetes, and 80% of them have no idea. They have never been told. They have never been diagnosed. They feel completely normal. They are going to work, raising their families, exercising occasionally, eating what they think is a reasonable diet, and their blood sugar is already elevated to a dangerous level and has been for years. So the question you need to ask yourself right now is not whether diabetes feels like something. The question is whether your body is already showing you the signs that most people never connect to blood sugar. Because those signs exist, they are real, they are specific. And millions of people are experiencing them right now and choking them up to stress, aging, poor sleep, or just being busy. They are dismissing the very signals their body is sending them because nobody ever told them what those signals actually mean. That is what we are going to do today. We are going to go through the real warning signs that diabetes has already started, not the dramatic symptoms that show up after years of full-blown uncontrolled disease, the early quiet signals. The ones that show up when the disease is still in its beginning stages, when there is still time to reverse it or dramatically slow it down. We are going to talk about what is actually happening inside your body when these signs appear so you understand the biology, not just the checklist. And we are going to talk about what you can do about it, because understanding this without acting on it helps no one. Let us start with what diabetes actually is at its core, because a lot of people have a vague understanding that it involves sugar and insulin but do not fully grasp the mechanism. Type 2 diabetes is fundamentally a disease of insulin resistance. Your body produces insulin just fine in the early stages. Your pancreas is working. The problem is that your cells have stopped listening to it. Insulin is a hormone that acts like a key, unlocking your cells so glucose from your blood can enter them and be used for energy. When your cells become resistant to insulin, the key no longer works properly. Glucose cannot get into your cells efficiently. It stays in your bloodstream. Blood sugar rises. Your pancreas responds by pumping out more insulin to try to force the system to work, and for a while it manages. Blood sugar stays in a range that looks relatively normal on a test, but the pancreas is working harder and harder. Insulin levels are chronically elevated, and the damage is accumulating invisibly. This stage where insulin is high and the system is straining but blood sugar has not yet crossed the diabetic threshold is exactly where most of the 96 million pre-diabetic Americans are right now. They are in the hidden phase, the phase where the machinery is struggling but has not yet broken. And this is the most important phase because it is the most reversible. The interventions that work best work here, before the pancreatic beta cells that produce insulin start to fail from years of overwork, before the blood vessel damage becomes permanent, before the nerve damage becomes irreversible. So what are the signs that you are already in this phase or beyond it? What is your body trying to tell you that you might be missing? The first and most overlooked sign is fatigue. That does not make sense. Not the normal tiredness you feel after a busy week or a bad night of sleep. This is a deeper, more persistent exhaustion. You sleep 7 or 8 hours and wake up tired. You get through the morning on caffeine and hit a wall in the early afternoon that feels like someone turned off a switch. You feel heavy. foggy, like your brain and body are running on reduced power even when objectively you should have enough energy. This happens because of exactly what we just described. When your cells are insulin resistant, they cannot absorb glucose efficiently. Even though your blood has plenty of sugar in it, your cells are starving for energy. Think of it like having a house full of food, but the doors to every room are locked. The food is there, but you cannot get to it. Your cells cannot get the fuel they need to function properly, so you feel constantly depleted. And because this happens gradually over years, most people adapt to it. They normalize the fatigue. They tell themselves this is just what getting older feels like. They start drinking more coffee, they push through. And the underlying cause continues unchecked. The second sign is excessive thirst combined with frequent urination. These two always go together and they are among the most classic early signs that blood sugar has been elevated for a while. Here is why they happen. When blood sugar rises above a certain threshold, your kidneys work to filter the excess glucose out of your blood and excrete it in your urine. But glucose pulls water with it when it leaves the body. So you are losing more fluid than normal through urination. Your body detects the fluid loss and triggers thirst to make you drink more. You drink more, urinate more. The cycle continues. Many people with elevated blood sugar notice they are going to the bathroom more than they used to, especially at night. They might get up once or twice to urinate when they never used to do that. They carry water bottles everywhere. They feel parched even after drinking. These are not signs of drinking too much water. They're signs that your body is trying to manage blood sugar that has gotten too high by flushing it out through urine, and the cost of that flushing is constant thirst and frequent trips to the bathroom. The third sign is blurry vision that comes and goes. This is one that catches people off guard because they immediately assume they need a new glasses prescription. And sometimes they do. But when blurry vision appears alongside other signs on this list, it is worth considering blood sugar as a potential cause. Here is what happens. Elevated blood sugar causes fluid shifts throughout the body, and the lens of your eye is sensitive to those fluid changes. When blood sugar is high, fluid can be drawn into the lens of the eye, causing it to swell slightly. This changes the shape of the lens and alters how it focuses light onto the retina. The result is blurry vision that may fluctuate based on how high or low your blood sugar is at any given time. This early vision blurriness from blood sugar fluctuation is different from the severe diabetic retinopathy that develops after years of uncontrolled diabetes. Retinopathy involves actual damage to the blood vessels of the retina and can lead to serious vision loss. The early blurriness we are talking about is reversible if blood sugar is brought under control, but it is a signal you should not ignore. If you notice your vision seems sharper on some days and blurry on others, or if you have recently needed multiple prescription changes in a short period of time, blood sugar should be on the list of things your doctor checks. The fourth sign is wounds and cuts that heal more slowly than they should. You might notice that a small cut on your hand or a scratch on your leg takes what seems like a long time to close up and heal properly. Maybe it gets slightly red or irritated more easily than it used to. Maybe bruises take longer to fade. This happens because elevated blood sugar impairs multiple systems involved in wound healing. It compromises the function of white blood cells, which are your immune system's frontline responders. It reduces circulation to small blood vessels, meaning wounds get less oxygen and fewer nutrients. It creates an environment that is more favorable to bacterial growth and infection. And it impairs the production of collagen, which is the structural protein your body uses to rebuild in damaged tissue. This impaired wound healing is one of the reasons why uncontrolled diabetes in its more advanced stages leads to serious complications like diabetic foot ulcers that can become infected and difficult to treat. But the slow healing sign shows up long before things get to that point. It is your body's way of signaling that the internal environment has shifted and the repair systems are not working at full capacity. A fifth sign is tingling, numbness, or a burning sensation in your hands or feet. This is often described as feeling like pins and needles or like your feet are perpetually slightly asleep. Some people describe it as a burning warmth or a buzzing sensation. This is an early form of peripheral neuropathy, which is nerve damage caused by prolonged elevated blood sugar. The nerves in your hands and feet, being the longest nerves in your body and furthest from the central blood supply, are the first to be affected. Fourth, elevated blood sugar damages nerves through several mechanisms. It impairs the small blood vessels that supply oxygen and nutrients to nerve tissue. It causes a buildup of certain byproducts of glucose metabolism that are directly toxic to nerve cells. And it creates chronic inflammation that damages the myelin sheath surrounding nerve fibers, disrupting the signals nerves send and receive. The result is the tingling, numbness, and burning that so many people dismiss as circulation issues or just tiredness in their feet. Early peripheral neuropathy is another warning sign that tends to develop over years before people connect it to blood sugar. Many people assume their feet tingle because they have been sitting in an awkward position or that their hands go numb because of something structural like carpal tunnel. And sometimes those explanations are correct. But when this symptom is persistent, especially in both hands or both feet simultaneously, and when it appears alongside other signs on this list, blood sugar should absolutely be investigated. The sixth sign is skin changes, particularly dark velvety patches that appear on the neck, armpits, groin, or other skin folds. This condition is called acanthosis nigricans, and it is one of the most visible external signs of insulin resistance. When insulin levels are chronically elevated, the excess insulin binds to certain skin receptors and stimulates abnormal skin cell growth. The result is patches of skin that become darker, thicker, and have a texture somewhat like velvet. These patches most commonly appear on the back of the neck, in the armpits, in the groin area, and in other places where skin folds meet. Many people who have these patches assume they are a hygiene issue or a skin condition unrelated to their metabolism. But acanthosis nigricans is so strongly associated with insulin resistance that doctors specifically look for it as a clinical indicator. If you have noticed these kinds of patches appearing or darkening over recent years, it is a significant sign that your insulin levels have been elevated and your body has been in an insulin-resistant state for some time. Getting your blood sugar and fasting insulin levels checked is essential if you see this sign. Many people who have these patches assume they are a hygiene issue or a skin condition unrelated to their metabolism. But acanthosis nigricans is so strongly associated with insulin resistance that doctors specifically look for it as a clinical indicator. If you have noticed these kinds of patches appearing or darkening over recent years, it is a significant sign that your insulin levels have been elevated and your body has been in an insulin-resistant state for some time. Getting your blood sugar and fasting insulin levels checked is essential if you see this sign. The seventh sign is unexplained hunger that returns too quickly after eating. You eat a full meal, maybe pasta or rice or bread, foods that should be filling, and within an hour or two, you are ravenously hungry again. Not just slightly peckish, but genuinely hungry, as if you had not eaten much at all. This happens because of the same fundamental problem driving all the other signs. Your cells are insulin resistant. Glucose cannot enter them efficiently. Even though your blood sugar just spiked from the meal you ate, your cells are not getting properly fueled. Your brain receives signals that the cells are still energy deprived, and it triggers hunger to make you eat more. This creates a cycle where you eat. Blood sugar spikes, insulin floods in trying to manage it, blood sugar then drops quickly, creating reactive hypoglycemia, and hunger returns intensely. Many people in the pre-diabetic and early diabetic range, easy diabetic range, use a roller coaster blood sugar pattern and respond by eating more frequently, often reaching for more carbohydrates and sugar, because those provide the quickest relief from the hunger and energy crash. This perpetuates and worsens the underlying insulin resistance. It is a self-reinforcing trap that the body creates when blood sugar regulation has already been disrupted. The eighth sign is unexplained weight changes, particularly difficulty losing weight around the midsection despite reasonable efforts, or in some cases unexplained weight loss. Let us talk about both because they represent different stages of the same underlying problem. Difficulty losing abdominal fat is extremely common in people with insulin resistance. When insulin levels are chronically elevated, the body